They're the calm in the chaos and the steady hands in the most critical moments. We had the opportunity to get a behind-the-scenes look at the day in the life of a nurse, following 3 different nurses from Community's 3 hospitals to see what it's like caring for Valley patients.
My name is Brenda. I work as a nurse in the emergency department, and I have worked for Community Regional for a year now.
My name's Harkenrider. I'm a charge nurse here at Clovis ED. I've been here for 12 and a half years.
Yep, no straw. Thank you.
My name is Bailee, and I am a nurse structural heart coordinator at Community Medical Center.
Thank you.
I have done night shifts since I finished nursing school. We start our shift at 7 p.m. and we get off at 7:30 a.m. So I'll typically get up maybe around like 3 p.m. because I like to go to the gym before work, do a quick 1-hour workout, shower, get ready, make sure I grab something to eat since it is a 12-hour shift, and make it to my shift report by 7.
So beginning of the shift, it's kind of the calm before the storm. We're gonna go in, get report, go to huddle, get the staff all ready to go for shifts, and kind of see what lies ahead.
I come to usually Fresno Heart Hospital is where my office is. So I will kind of get my things situated, see what's on my schedule for the day, and go from there.
Tonight I will be working in the trauma zone. We get patients through the ambulance, patients that drive themselves here. That's one of the things I like about the emergency department. You never really know what you're gonna get. So I just got a call from our nurse up in the front. Looks like we have a 32-year-old male, has a laceration wound to his right hand after doing some gardening. So we're gonna bring him back here, take a look at it, have the doctor take a look, see if he might need some stitches, and we'll kind of go from there and see what they order.
Surveys are state and federal regulatory compliance checks. We just cleared a survey yesterday, so it was a good mood this morning. It was great.
Everything that you guys were doing was just so amazing. So be relaxed today and have a good day. Today is the best day ever after a survey. Are we good? We're good. Enjoy the moments, one thing at a time.
Hi, this is Bailee calling from Fresno Heart and Surgical Hospital. How are you? So I help with our TAVR program here. TAVR stands for a transcatheter aortic valve replacement. So with that, we're able to place a new valve, but in a less invasive approach of going through the groin. I was calling because I received your name as a possible referral for a I help get the referral situated. I call the patients, give them education. I'm there during the cases to make sure all team members arrive on time and are present and make sure the case plan is acted out. And I also help with some of our follow-up work as well.
So heading back to red, we're gonna be red flow, main charge flow today. So we'll go back, get a report from night shift, and kind of see what we got going starting the day. Anything good?
2A is an overdose. He should be cleared at 8.
Okay. 2A is not a high risk or anything?
No.
Okay. Red zone is like our critical care area for the ED. Helicopters will come, so it's like our high intensity area. It can be crazy sometimes.
Let me see. Are you able to wiggle your fingers for me?
Barely.
Okay, go ahead and open your hand. I just want to make sure that your sensation is intact. Can you feel me touching you here?
Yes.
Okay, perfect. I'm gonna just take a quick look, okay? Oh yeah, you are definitely gonna most likely need some stitches, but I'll let the doctor decide that. We're gonna get you connected to the monitor and then we'll kind of go from there, okay? So the doctor came and took a look. The patient is gonna require some stitches. So I'm gonna get a lac repair setup ready. The doctor will come, numb up the area for the patient, stitch up the patient's hands, and we will get that patient discharged. So I just got relieved to go on my first break. It is night 4 of 4 for me. So caffeine is my best friend on the last night to help get me through tonight.
All right, so I'm just heading down to pre-op to go see one of our TAVR patients. They're having their case today, so gonna answer any last minute questions before they go back.
Yeah, so what exactly are we going to be doing today?
So we're gonna replace your aortic valve, but we're gonna do a less invasive approach and go through your groin. We're getting the room ready and we'll get you back there shortly.
Awesome, thank you, Bailee.
You're welcome.
Unit 168, calling Clovis, go ahead.
I will be there in a few minutes now. How do you copy?
168, continue to monitor and transport. See you in 5. Looks like we have a patient coming in with a mental health issue.
RMC, Brenda Gaona, go ahead. Basically, the call that I got earlier was a patient that called 911. I think she was like 38 or 39 weeks pregnant. She wasn't actively in labor or anything like that. I copy 6 minutes out with a 41-year-old female. Chief complaint is abdominal pain. Go ahead and go to short stay. I will call L&D, let them know that you are 6 minutes out with the patient. I was able to let the labor and delivery know to give them a heads up on a patient that they were expecting. All right, thank you. Bye-bye. There are some times where they come into the emergency department in active labor. Personally, for me, I don't really like labor and delivery. It's not my cup of tea, but it is different. The first time I experienced it, I've had kids myself, but it was just different to be able to see that.
Sorry you're going through a hard time. What's been going on at home? An odd question, you wish to be dead right now? Okay. Have you tried anything in the past to end your life like this? No, this is the first time? I'm sorry, my friend. Well, let's get you some help, okay? The doctor's gonna come down and get you evaluated and see what help we can get you, okay?
We do see a lot of challenging and life-changing things that not everybody sees. A lot of us tend to say we're trauma bonded, you know?
The biggest challenge is just nurses to the amount of patients that we have. And it's a whole Central Valley problem. We don't have enough doctors. Hey, Sarah, what's up?
Hey, how busy are you?
I'll be right there to help you out. See you soon.
The most rewarding thing I do in my job is I actually get to call the patients about a month after and a year after. It's so great to hear how their symptoms have improved, how they're feeling so much better, and they're just so grateful for the care that's been provided for them.
I love all the experiences I get, but a big part of it is my coworkers. I feel like my coworkers are one of the main things that keeps me coming back and just being able to make a difference for patients.